7 night signs of diabetes you should know. Diabetes is a silent and cunning enemy that doesn't stop, even when the clock shows midnight. As darkness falls, the body begins to send important signals that often go unnoticed. Night symptoms can be crucial to recognize and understand, as they indicate that blood sugar levels might not be under control. Do not ignore these signs, as they might be the key not only to improving sleep quality but also to safeguarding your long-term health. In this video, I will share with you 7 night signs related to diabetes that you should not neglect. Timely identification and response to these symptoms can help avoid serious complications. But first, please give this video a like and subscribe to this channel. This is very important for us and helps us bring more helpful content like this. Thank you very much for your support. 1. Night sweats, causes and measures to take. Night sweats are not just a minor annoyance that disrupts peaceful sleep, they can be a significant indicator of glucose level disturbances, especially for those suffering from diabetes. Their occurrence is often linked to hypoglycemia, a dangerous drop in blood glucose levels, which mainly happens at night when the body isn't able to regulate sugar effectively. Main causes of night sweats. Medications or intensive insulin therapy, some drugs used to control diabetes, can cause unexpected drops in glucose levels at night. Irregular eating, skipping meals or having inappropriate food before bedtime can increase the risk of hypoglycemia. Intense physical activity in the evening, late-day exercises can lead to a delayed drop in blood glucose levels during the night. Why night sweats are dangerous? Waking up wet from sweat, aside from causing annoyance and interrupting sleep, signals that blood glucose levels have fallen to a dangerous point. If this situation repeats and is not managed, it can lead to serious complications, including dizziness and confusion in the morning, increased risk of loss of consciousness at night, general deterioration of health condition. Measures to prevent night sweats. Monitor blood glucose levels. Checking glucose levels before bed is crucial to prevent sudden drops at night. If levels are low, consume a small balanced meal containing slow carbs to maintain glucose stability. Adjust medication doses. In consultation with your doctor, adjustments to insulin therapy or diabetes medications might be necessary. Keep a quick source of glucose by the bed. This could be in the form of glucose tablets, a bottle of fruit juice, or a caffeine-free energy drink. In case of glucose level drops, these can be lifesavers. 2. Nocturia, causes, symptoms, and measures to take. Nocturia is a condition characterized by the frequent need to urinate at night, directly affecting sleep quality and overall well-being. For diabetic individuals, this condition is quite common as high blood glucose levels push the body to eliminate excess sugar through urine. Though often ignored as something common, nocturia is a significant indicator of glucose imbalance and might warn of the need to adjust diabetes treatment or lifestyle. Why does nocturia occur? In individuals with diabetes, when blood glucose levels are too high, the kidneys try to balance this by expelling excess sugar through urine. This process requires more fluids, increasing urine volume and leading to frequent urination, especially at night. Symptoms and impact on daily life. Nocturia disrupts the natural sleep cycle, causing several issues, including fatigue and drowsiness during the day. Sleep interruption negatively impacts energy levels and concentration ability. Reduced vigilance and productivity. Lack of uninterrupted sleep can affect performance at work or in daily activities. Increased stress and emotional irritation. A disrupted sleep cycle can worsen emotional state and increase stress levels. How to manage nocturia. Monitor blood glucose levels. Regular glucose checks before bed are vital to avoid unexpected rises at night. Limit fluid intake in the late hours. Try to avoid consuming fluids 2 to 3 hours before bed, especially those containing caffeine or alcohol, as these substances can increase urine production. Keep a sleep and urination diary. This helps to identify patterns and discuss them with your doctor. 3. Restless leg syndrome, symptoms, causes, and measures to take. Restless leg syndrome, RLS, also known as restless leg syndrome, is a neurological disorder causing an uncontrollable urge to move the legs. This sensation is often accompanied by other unpleasant symptoms like numbness, itching, or the feeling of something crawling on the skin. It worsens mainly during rest periods or at night, disrupting sleep and causing significant daytime fatigue. For individuals with diabetes, this condition is often linked to peripheral neuropathy, a common complication resulting from high, uncontrolled blood sugar levels. Causes of restless leg syndrome. RLS can have a genetic basis or be associated with other health conditions, but for diabetics, it is often an indicator of peripheral neuropathy. Some factors that might trigger or worsen symptoms include high blood sugar levels, uncontrolled. These can damage nerves and cause unusual sensations in the legs. Iron deficiency or anemia, low iron levels can increase RLS risk. Excessive use of caffeine and alcohol, these substances can exacerbate symptoms. Stress and excessive fatigue can intensify the unpleasant feelings in the legs. Main symptoms of restless leg syndrome. Unusual sensations in the legs, often described as burning, numbness, or stabbing sensations. Uncontrollable urge to move the legs, especially when at rest, like at night or during prolonged sitting. Worsening at night, symptoms are typically more intense in the evening and at night, interrupting sleep and causing daytime fatigue. 4. Nighttime hypoglycemia, a hidden risk at night. Nighttime hypoglycemia refers to the drop in blood sugar levels during sleep. This is a particular risk for individuals with diabetes, as it often goes unnoticed until morning. Unmanaged, sudden hypoglycemia can lead to severe complications, including seizures, loss of consciousness, and, in extreme cases, life-threatening consequences. Main symptoms of nighttime hypoglycemia. While some individuals might not have clear signs, others experience a series of symptoms that clearly indicate low blood sugar levels. These include excessive night sweating, often waking up damp with clothes sticking to the body. Vivid or scary dreams, these dreams are a possible indicator of low glucose levels. Waking with headaches or deep fatigue, low blood sugar levels at night affect brain function, causing morning headaches. Rapid heart rate and tremors, caused by the body's attempts to restore blood sugar levels. Consequences of nighttime hypoglycemia. If hypoglycemia lasts for long periods without intervention, it can lead to severe complications. Severe cases might include seizures, loss of consciousness, long-term neurological function damage if the episode often repeats. When to seek medical help. If you frequently experience nighttime hypoglycemia, it's vital to consult with a doctor. A healthcare professional can adjust your treatment plan and suggest other strategies to avoid complications. 5. Sleep apnea. Sleep apnea is a medical condition characterized by interruptions or shallow breathing during sleep, resulting in frequent awakenings. This problem is of particular interest to diabetics, as inadequate sleep and reduced oxygen levels can increase insulin resistance and worsen blood sugar control. Obesity, a known risk factor for type 2 diabetes, often contributes to sleep apnea. Treatment usually involves a combination of lifestyle changes and medical interventions. Weight loss can be effective, as even a slight reduction in weight can significantly improve symptoms. For immediate relief, PAP machines are often used. Furthermore, avoiding alcohol and sedatives which relax the muscles of the airways and choosing to sleep on the side instead of the back can prevent airway obstruction. Effective management of sleep apnea can result in better control of blood sugar levels and an increase in overall well-being. 6. Frequent thirst at night, what you should know and how to manage it. Frequent thirst at night is a symptom that affects many diabetics and is often linked to hypoglycemia, high blood sugar levels. This phenomenon is not just a temporary concern but a signal indicating that the glucose balance in the body is unstable. Why does thirst occur at night? When blood glucose levels are high, the body tries to eliminate the excess through urine. This process draws water from cells, causing dehydration and triggering the sensation of thirst. As a result, the individual starts a continuous cycle of drinking water and frequent urination, which disrupts sleep and negatively impacts life quality. Consequences of frequent night thirst. This ongoing cycle can have several consequences. Insomnia and sleep interruption. Frequent waking to drink water and urinate causes chronic fatigue and drowsiness during the day. Chronic dehydration. If the body doesn't recover the lost water, headaches, dry mouth, and physical weakness can occur. Slowing overall diabetes improvement. If this symptom is not managed, it might signal poor blood sugar control. How to manage frequent night thirst. Managing night thirst requires a balanced approach between maintaining hydration and controlling blood glucose levels. Some practical steps include: regularly monitor blood sugar levels, especially before bed. If they are high, try to adjust your diet or insulin dose in consultation with your doctor. Adjust fluid intake throughout the day, distribute water consumption evenly, and limit large amounts in the evening. Avoid caffeine and alcohol before bed. Both act as diuretics, promoting urination and exacerbating the symptom. Keep a glass of water by the bed, instead of getting up to go to the kitchen. A small amount of water by the bed can help minimize disturbances. 7. Night cramps. Night cramps, characterized by sudden and painful muscle contractions, usually in the legs, are a source of anxiety for diabetics. These cramps can be caused by high or low blood sugar levels, reduced circulation, or diabetic neuropathy, a nerve disorder resulting from prolonged high blood sugar. To control and reduce night cramps, maintaining stable blood sugar levels is essential. Regular monitoring and adherence to medication regimes can help manage glycemia. Additionally, light stretching exercises before bed, particularly for calf muscles, can relieve tension and reduce cramp risk. Maintaining hydration and ensuring a balanced intake of minerals like magnesium and potassium, along with using supportive shoes, can prevent cramps. Warm baths or thermal packs might offer immediate relief. If cramps persist or intensify, consulting a doctor to explore underlying causes and get appropriate treatment is crucial. Recognizing signs is the first line of defense for effective diabetes control, improving not only sleep quality but also overall condition management. We've just reviewed 7 night signs associated with diabetes that are essential to recognize and monitor carefully. Awareness and acknowledgement of these signs can make a big difference in how you manage your health, especially at night. Symptoms like night sweats, excessive thirst, hypoglycemia, and restless leg syndrome should not be neglected, as they are significant indicators of unstable blood sugar levels. Keeping glucose levels under control not only helps in reducing these nighttime disturbances, but contributes to an overall improvement in life quality and prevents serious diabetic complications. Regular monitoring, adopting a healthy lifestyle, and consulting with your doctor when these symptoms become recurrent are essential steps for successful diabetes management. Remember, daily care and quick response to these signs can be crucial for your long-term health. Don't hesitate to share this information with friends and family who might benefit from it. Don't hesitate to consult a doctor if you're facing any of these issues. Early intervention and a tailored treatment plan can make a difference in improving your health. And of course, continue to follow us for more health tips and information. If you liked the video, don't forget to leave a like and subscribe to our channel to not miss our upcoming videos. Your support helps us spread this information to more people who need it. Thank you very much for taking the time to watch this video. Thank you from the heart. I wish for your health and happiness. Goodbye, and may you always have good health.